I think one of the big problems is we know that COPD is one of the most common lung disorders that exist. We know in the United States there's approximately 15 million people that have chronic obstructive pulmonary disease, but there's probably another 15 million that actually have the disease and don't carry the diagnosis. They don't know they have the disease. If you think about it, many times when people get older, they think, oh, I'm just getting tired, I can't quite exercise as much as I can, I'm a little bit more fatigued, I'm short of breath, and that's just part of aging. But if you really think about it, many of these people, especially if they've been exposed to cigarettes or they're cigarette smokers, or if they've even had exposure to dust or other irritants to the airway, they can get inflammation and then damage to the lungs to where they actually have abnormal lung breathing capacity. We used to think about COPD as being a disease of older men who smoked, and yet if you look at the statistics now, COPD is predominantly a disease of females. There's more females in the United States with COPD than males, and it's actually been diagnosed at much earlier ages now. There's a significant group of people between the age of 20 and 45. As much as a quarter of people can actually develop COPD at a younger age. I think that sometimes people have the insight themselves to say this just isn't right, but we often see spouses come in and say, you know, you're coughing throughout the day, you're bringing up sputum. Chronic cough and chronic sputum are not normal, even when people smoke. And people say, oh, I just have a smoker's cough. It's a myth that smoking without any kind of inflammation of the lung or airway should cause chronic cough and sputum production. If you think about it, other than shortness of breath, cough and sputum production are the most common symptoms for patients that have COPD. The entire program is designed first to educate people and let them know that if they don't feel like they have normal breathing capacity, or if anything has changed, if they can't really do what people of their own age group can do, be that at the age of 30, 40, 50, or into their 80s, then really they need to talk to somebody and be tested to see if they could have obstructive lung disease. Then it actually teaches them about medications, how to use the medications. Again, many of these are inhaled medications that go to the lungs with no side effects, yet are very, very effective at getting rid of symptoms of shortness of breath. And then it goes on to talk about eating habits, life changes, how to work with people if you are a smoker. Again, the average person who smokes cigarettes has tried to stop at least 5 to 7 times before they're successful. So I think it's important for people not to give up and say, well, I tried twice and I can't quit. They need to say, well, I've made that beginning, and like many people who are lifetime non-smokers now, it's going to take time, it's going to take effort. And then it also talks about exercise and rehab and how important those things are.